A randomized trial of hyperimmune globulin to prevent congenital cytomegalovirus. Congenital cytomegalovirus occurs when an infected mother passes CMV to the fetus through the placenta. The mother's illness may to have symptoms, so she may be unaware that she has CMV.
You're doing great. For Nicholas Bronson, taking these first steps at 5 years old was monumental.
Application in medicine. Background. Congenital infection with human cytomegalovirus is a major cause of morbidity and mortality in an uncontrolled study published in 2005 administration of CMV-specific hyperimmune globulin to pregnant women with primary CMV infection significantly reduced the rate of intrauterine transmission from 40% to 16%. Methods. We evaluate the efficacy of hyperimmune globulin in a phase 2 randomized placebo-controlled double-blind study. A total of 124 pregnant women with primary CMV infection and 5 to 26 weeks of gestation were randomly assigned within 6 weeks after the presumed onset of infection to receive hyperimmune globulin or placebo every week until 36 weeks of gestation or until detection of CMV in amniotic fluid.
Only at Fox, it's a scary story about women who are pregnant.
Here's a problem that we had not heard about until just last month. Keith Yaskin on a rare but devastating virus.
She can't walk. Yeah, I have to carry her.
At first you wonder how Heather Key in Phoenix finds her passion and upbeat personality in what appears to be a very difficult situation.
I'm doing a lot better than I was 4 years ago.
It is hard to see a 5-year-old girl like Katie living life with so many health challenges.
I knew right away that something was wrong because just the way she acted. And then at 6 months, she wasn't doing anything. She just laid and stared into space. She did absolutely nothing. She has a feeding pump.
A tube is in her belly.
You're half crying and half laughing. Huh?
When we spend time with Heather and her daughter, Katie is not in the best of moods.
She's really normally very happy, a lot more happier than she is today.
Mom shows me pictures of a better day.
She is normally just ridiculously happy that I wish that I could be in that place sometimes. So wherever she is, to be that happy all the time.
Heather and Katie help open a discussion about a common but rarely known virus known by 3 letters. CMV.
Results. A total of 123 women could be evaluated in the efficacy analysis. 1 woman in the placebo group withdrew. The rate of congenital infection was 30%. 18 fetuses or infants or of 71 women. In the hyperimmune globulin group and 44%, 27 fetuses or infants of 72 women. In the placebo group, a difference of 14 percentage points, 95% confidence interval, 3 to 31. There was no significant difference between the 2 groups or within each group, between the women who transmit the virus and those who didn't, with respect to level of virus-specific antibodies, T-cell mediated immune response, or rival DNA in the blood. The clinical outcome, the congenital infection adverse, was similar in the 2 groups. The number of obstetrical adverse events was higher in the hyperimmune globulin group than in the placebo group. Pros and cons. Cons: inflammation of the retina, large spleen and liver, low birth weight. Mineral deposit in the brain, small head size.
In terms of another virus that sometimes comes, brings a lot of questions as to testing. There is one virus called Citomegalovirus. And cytomegalovirus gets its name for what it does to the cells. It actually, under the microscope, makes the cells like giant cells or something. They look very big. And so the name cytomegalovirus. In a simple manner for the lay person, I think it's the model that we all know about. Chickenpox and measles and German measles, childhood illnesses, is a good example of how most things respond with cytomegalovirus. First of all, the vast majority of the population has been exposed and has had cytomegalovirus. It often will happen in childhood or adolescence, teenage years, early adulthood. It will be exposed through some kind of intimate contact, whether it's a sneeze or a kiss or something else. Sexual activity possibly can do it. It shows itself as an influenza-like syndrome. Fever, you don't feel well, you're not hungry, you're nauseous, you're vomiting, you don't want to get out of bed, you want to sleep, you're dizzy. It looks like a flu. And for the vast majority of people, they will have, quote, a bad flu with maybe 102 fever. For an adult, you know, that's a lot of fever. And it will pass, and that will be the end of it. And they'll think that they just had maybe some kind of a flu, the seasonal flu or something, and in fact what they had was a CMV. When a mother who is pregnant gets CMV, it is a different circumstance. And it crosses the placenta. It infects the fetus. The fetus has an immature immune system. And so in the fetus it can cause much more severe infection. It can cause encephalitis. It can cause hepatitis. It can cause blindness, deafness, similar as German measles can, rubella.
Diseases. CMV mononucleosis. This syndrome resembles infection mononucleosis, but the EVV causes classic mononucleosis. If you have signs and symptoms that resemble mononucleosis, a sore throat, swollen glands and tonsils, fatigue and nausea, your doctor will test you for the antibody your body makes to fight off EVV.
Hello, my name is Dr. Carlo Ojeda, emergency physician. In this video, I will attempt to answer the question, can a person get infectious mononucleosis twice? The short answer is yes. Most patients who get infectious mononucleosis get it only once, but on rare occasions it can reinfect the same host. Once you've had infectious mononucleosis, you will carry the Epstein-Barr virus in your system. However, you will not feel ill. You are a carrier of the disease. In this picture, we show some of the symptoms of infectious mononucleosis. More than 95% of adults worldwide are infected with the Epstein-Barr virus. Therefore, they're all carriers. Periodically, however, the virus may reactivate. When this happens, the virus can be detected in your saliva, but you're not likely to become ill. Rarely, reactivated Epstein-Barr virus may cause illness in people who have weak immune systems.
Intestinal complications in CMV infection in your intestines can result in diarrhea, fever, and abdominal pain, inflammation of your colon and blood in your stool, liver complications, nervous system complications, and lung complications.
I'll give 5 bonus points to whoever can name the Japanese character on this. We are now in the third video about the Herpes viridae family. This is a high-yield family for the national boards. Today we begin with the subfamily Beta herpes virinae. Their replication cycle is much slower than the alpha group. They They establish latency in non-neural tissues, particularly lymphoreticular cells and glandular tissues. Citomegalovirus, the topic of today's presentation, mainly establishes latency in mononucleoleucocytes, such as monocytes and macrophages. It is a very widespread virus. Depending on geographic location and socioeconomic group, 35 to 90% of the population produces anti-CMV antibodies by adulthood. Both primary and secondary infection are generally asymptomatic and are characterized by shedding of virions. This description of a virus that everybody has and is generally asymptomatic should sound like another pair of viruses that we covered.